The first teeth begin to break through the gums at about 6 months of age and are usually the two bottom front teeth. Next, the top four front teeth emerge. After that, the other teeth slowly begin to fill in, usually in pairs, one each side of the upper or lower jaw, until all 20 teeth have come in. The complete set of primary or baby teeth is in the mouth by 2.5 to 3 years of age. Primary teeth reserve space for their permanent counterparts. Primary teeth aid in the development of clear speech. Primary teeth help attain good nutrition. Missing or decayed teeth make chewing difficult, causing children to reject foods. Primary teeth give a healthy start to permanent teeth. Decay and infection in baby teeth can cause dark spots on the permanent teeth, developing beneath them. Permanent teeth come in around the age of 6. The first permanent molars are first to emerge. In some children, the incisors are first to emerge. By the age of 13, most of the 28 permanent teeth will be in place. third molars or wisdom teeth emerge between the ages of 17 to 21, bringing the total number of permanent teeth to 32. Teeth with deep pits and grooves are prone to decay. To avoid this, the pits and grooves are treated with an acid conditioner called etchant. The etchant creates surface roughness at the microscopic level. Sealant is then applied and then hardened with a special curing light. Dental sealants, as the name implies, follows into the surface roughness and seals the pits and grooves of the teeth from bacteria and other debris.
Take a look inside your mouth at the big molar teeth in the back. You see those deep grooves on the tops and sides? That's one of the most common places for tooth decay or dental caries to begin. You can help prevent cavities from developing by brushing after meals and snacks at least twice daily for 2 full minutes. Try to cut back on sugary snacks, soda pop, and sports and energy drinks. Otherwise, what's going on in these teeth could happen to yours. If food deposits are allowed to stay in the pits and fissures of the teeth, bacterial acids and enzymes can dissolve away the enamel. Acids from food and drink can also directly dissolve enamel. Here's another place where bacterial plaque accumulates, on the sides of the teeth along the gums and between the teeth. That's why it's so important to brush the sides of our teeth as well as the tops, angling the bristle tips beneath the gums, and then flossing between the teeth every day to get rid of the fuzzy plaque. If it's allowed to remain between the teeth, you may develop cavities on the interproximal surfaces, which require the removal of more healthy tooth structure to fix. It's also where most gum disease begins.
Root canal treatment begins with the standard drill to access the inside of the tooth. Slower speed round drills can then be used to remove decay and to expose the canals. Tiny files are then used to remove the contents of these canals. The manual method of root canal treatment involves using increasing file sizes that gently clean and shape these canals. A tooth may have 1 or more canals. Using the manual treatment method of filling the canals involves checking the cone size, then placing rubber cones covered with a liquid sealer into the canals. Once enough cones have been placed, spreading instruments can then be used to compact the cones even further. After the canal is tightly sealed, the excess rubber cones can be removed with a heated instrument. The heated instrument can also be used to heat and compact the cones to better fill the canal space. For optimum treatment, 1 or more posts may be placed to strengthen the tooth and retain the filling. In this case, a light-cured resin is used to fill the space. It's soft when placed in the tooth and hardened with a bright light. At this point, the tooth is still in a weakened state and can break with heavy biting. The best treatment usually involves preparing the tooth and covering it with a full crown, sometimes called a cap. Any pathology at the tip of the root should disappear with time, and the tooth will be saved.
Your teeth are held in place by their roots in the jawbone. Tooth decay, disease, or trauma may have caused the loss of several teeth. Immediately after tooth loss, the jawbone will begin to resorb or shrink. Over time, the ridge of the jawbone becomes much thinner, limiting the options and possibilities of tooth replacement. The remaining teeth no longer have the support that the lost teeth and bone provided. With no support, the teeth begin to drift and erupt toward the open areas. The overload can move and weaken those teeth, possibly leading to additional tooth loss.
Durante la masticación se produce un impacto de los alimentos contra la encía, que puede dañarla y generar molestias. Esto dificulta y hace incómoda dicha función, por lo que tendemos a masticar únicamente por el otro lado, provocando un mayor desgaste de este último. La ausencia de contactos provoca una movilización de los dientes adyacentes al espacio vacío, que buscan el contacto con el diente perdido, inclinándose y cerrando el espacio. Del mismo modo, el diente contrario erupciona buscando el contacto correspondiente. Esta movilización generalizada puede desencadenar a su vez otros problemas. Los contactos interdentales se vuelven irregulares e incluso se abren, facilitando así la retención de alimentos entre los dientes y por ello la aparición de caries. Además, la nueva posición de los dientes dificulta la higiene y genera espacios en los que puede formarse sarro con facilidad, favoreciendo la aparición de periodontitis. Esto suele ser especialmente grave en el caso del diente contrario, ya que al erupcionar excesivamente disminuye la porción de raíz que permanece dentro del hueso, pudiendo incluso presentar movilidad. La alteración de la posición de los dientes genera numerosos contactos indebidos durante la masticación, forzando cargas sobre ellos y causando desgastes prematuros. La sobrecarga masticatoria provoca a su vez un empeoramiento del estado periodontal del diente, generando más movilidad y dolor, llegando incluso a poner en peligro su continuidad en la boca. Para corregir esta situación, no solo debemos reponer el diente que falta, sino también restaurar la relación de mordida a su punto original, obligándonos en muchos casos a realizar tratamientos complejos, en los que incluso podemos necesitar realizar endodoncias de los dientes que más se han movido. Por todo ello, es muy importante que ante la pérdida de un diente lo restauremos cuanto antes, evitando así, en la medida de lo posible, todos los problemas que puede provocar.